Actually, when you first look at it, it may not seem very impressive because it's so small, right? Which is what we love about it, though. So this is the ultrasound machine here. The brand name is called Clarius. And it's, you know, very easy to move around, very, very portable. That's why we can easily go from, you know, it can go from one place to the other. And it's wireless. You see, there's nothing attached to it. So the way that it works is that it transmits a wireless image to an iPad. So also very easy to move around. So we have an iPad, we have a wireless ultrasound machine here. That way we can see the image. I can see exactly where the tip of the cannula is. I can make sure that it's in that safe space between the skin and the muscle. That's where you want to be. That's where we place the fat, okay? And that will greatly, greatly minimize the risk of any potential fat embolus and, you know, bad outcomes and death. So you can start sitting. I mean, ideally you don't want to sit too much in the first 2 weeks, but there are going to be occasions where you have to sit, right? When you're traveling, air travel, moving around in the car, things of that nature. So when you have to sit in the first 2 weeks, it's fine, and you can start using it then. And then after 2 weeks, certainly you can start using it a bit more liberally. So if you're like heading back into the office and things like that, you can use it for quite a bit longer. And then after 6 weeks is when you can sit normally. Yeah, so there are going to be different lengths there, but the mini, what you have to know is that the mini tummy tuck incision is not that short. So what makes a mini tummy tuck a mini is not so much the length of the incision, but the fact that you're not doing the plication, okay, and that you're typically not moving the belly button, okay. The mini tummy tuck incision is still going to be longer than your C-section scar, okay. So typically something about 8 inches or so, so longer than a C-section scar. And then you have your full tummy tuck where you're going to go from the little hip bone to hip bone. That's going to go from hip to hip. And then you have your extended tummy tuck where you're then now going to go around the corner, so towards the back and around the corner for your extended tummy tuck.
Thank you.
So they're not available here at Pure. In terms of, you know, one of the procedures that where we can reduce the pain significantly with the tummy tuck, we'll use that special shot. It's called BBL, okay? So it's an injection that you can place along the muscle repair and along the incision. And with that, we're able to decrease the pain for about 72 hours. So it's really, really excellent. So I recommend that for all tummy tucks, okay? For other procedures, most breast procedures, you don't really need a pain pump. They're not that painful. And for liposuction, you know, or BBL, it's tough. You can't really do the shot. And so for that, we rely mostly on your oral pain medication. Once you're home, while you're here in a recovery room, we can give you pain medication through your IV. Yes, yeah, that's actually a great question. So we have 2 rooms here where we prepare the patients for surgery. So when they come into the room, of course, they got to change out of their clothes. They have to put in all of what we call the gear, which is their compression stockings. You know, they're going to put on their gown, their hair covering piece, and that is the room where we kind of go through final questions. We make sure that there's no allergies, and then we do all the markings prior to the procedure, okay? Also in that room, oftentimes, not always, but oftentimes you can get your IV placed in that room as well. And then from there, you actually do have to walk. So it's a little bit different from a hospital where you're getting moved around in the stretcher. You do have to walk, so we're not going to give you any medications just yet. From there, you're able to walk into the operating room, and then you lay on the table. And that's where we then start giving you the medication so that you go under anesthesia. Just before giving the medication, we do then put up all your safety monitors and devices. So we put in the compression device for the legs to prevent the blood clots. We put in your blood pressure cuff. We put in the monitor that checks your oxygen levels. And then of course all the safety straps so you don't fall off the bed, right? And then you get your medication, and then anesthesia of course is in charge at that moment to placing the breathing tube and making sure that everything's okay. All right, how long does it take? Once we give that medication, you're out in about a minute.
Thank you very much.
And we look forward to hopefully seeing all of you guys here at Pure, but I will catch you next week on Hump Day with Dr. Alex Earle. Ciao.